Welcome back to the Great Work Podcast. Today on Great Work, Kirti sits down with Shane Brown, CEO of NurseIO, a healthcare staffing marketplace that's rewriting the rules on how nurses and facilities connect. Shane comes from a background in medical technology, giving him a unique perspective as a staffing executive. They discuss why traditional staffing models are breaking down, how NurseIO is using AI to onboard nurses in under 24 hours, and why same-day pay can be life-changing for caregivers. Shane also shares his journey from medtech to staffing, his take on the supply versus demand debate, and what great work really means when lives are on the line. Okay, let's get into it.
Great.
Hi, and welcome to episode 2 of the Great Work Podcast. Today I'm joined by Shane Brown, the CEO of NurseIO. Shane, thanks for coming on the podcast.
Hey, I'm glad to be here. Thank you.
Awesome. Well, Shane, obviously I know a lot about NurseIO, but maybe you could start off by just giving us a pitch of NurseIO. Like, what do you guys do for those that are unfamiliar with the model?
Yeah, we've designed a really interesting marketplace that connects healthcare facilities that need short-term help, primarily on the nursing side of their staffing, through any, different data sources. There's over 500,000 additional nurses are needed within our country today. And we just like to, connect the healthcare facilities that are trying to provide really good care with clinicians that don't want to be working full-time anymore, or just want a little bit more freedom and empowerment within their schedule. And we just help connect the two.
Absolutely. Nurse staffing has been huge, especially since the pandemic. Nurse staffing, I think, really just ended up surfacing, and people saw the impact of deploying these nurses across the United States in really hard to reach areas. So really love all that you guys are doing. And what particularly within NurseIO would you say is the niche that you're going after? Because obviously nurse staffing, I would say, is one of the pillars of the Holy Trinity. Professional services, light industrials, and nurse staffing. I would say nurse staffing is one of those big overarching industries in staffing. So what particularly are you guys tackling at NurseIO in that niche?
Yeah, we are consumed right now. We're about to launch into the hospital market and the ambulatory surgery center market. But up until this point, we've been really focused on detox and behavioral health and assisted living and nursing homes and rehabilitation centers, primarily for RNs and CNAs, nursing assistants. But it's kind of broadly the PRN category. It kind of just means temporary per diem staffing. That being said, our algorithm and our abilities, we can help to staff a lot of different roles within healthcare. And that's just really the start of what we're consumed with today.
That's awesome. And, Shane, I have so many questions that I want to dive into on NurseIO. But before we do that, I want to talk about you. So, you didn't really come from a staffing background, but really started working at really large major medtech companies like Abbott and GT Medical. What made you kind of make the switch into staffing?
Yeah, I've been in the medical device world in healthcare for almost 30 years. And I remember a conversation with my father when I was, kind of midway through college. And he said, "Hey, I think you'd, enjoy, being on the commercial side of a business because you build trust well and you communicate well and all these things and you're competitive. But make sure it's an industry that's growing and that is meaningful to you." And so at that time, I really put all my chips on the table for healthcare sales jobs. And I started out as a surgical rep, standing next to a surgeon with a patient on the table. And that's always been a really fulfilling thing for me. It's knowing that even though I may be on a late flight or in a conference room or with a board of directors or, looking at a spreadsheet, somebody within the team that I'm part of is helping a clinician take really good care of a patient. And so it's always been in the midst of a heart valve or an ablation catheter for a heart arrhythmia or a PICC line, or GT was radiation from the inside out for patients with brain tumors. All of those things meant a lot to me. And when I was thinking about this opportunity at NurseIO, it's the same exact sentiment. It just is eliminating the widget in between. I'm still consumed by and fulfilled by helping to line up the right clinician to take care of the right patient. Your family member, my family member, somebody else's neighbor, somebody else's colleague. If you don't have the right clinician, whether that's a nurse or an RT or a CNA or a home health worker, if you don't have those people lined up, somebody's not getting the care that they can, and maybe they have a little bit less hope. Maybe they're not going to recover as fast. But ultimately, our healthcare system and every healthcare system that's quality around the world is really contingent on the right ratio of caregivers to each individual patient to make sure that they get what they need.
I really like that, Shane, and I think that's a really unique perspective you bring. I've met many staffing leaders over the years, but I don't think I've met very many that come from sort of the med tech space. But I really love that you brought it home with, the overall mission being that the end person at the end of the day that's receiving care, and how can we make care more accessible and better for everyone across America. And kind of going back on the NurseIO side, so NurseIO, you guys really built this company as an on-demand marketplace for healthcare staffing. So what do you think is broken about the traditional staffing model? Because I think NurseIO is doing something really cool, but what do you think is broken and kind of sets you apart from the traditional sort of nurse staffing companies on the market?
Well, on the nursing side, people don't necessarily want to be working at one hospital or one nursing home for 40 or 50 hours a week for 30 years. People enjoy having flexibility now, and the quote unquote gig economy that really has gained steam in the last 10, 15 years took off, as you know, during COVID, and everybody was in need of more nurses, more staff, more home delivery services for Uber Eats or Grubhub or all of these things. So I think generationally, people want more control and empowerment to work where and when they want to, and not necessarily putting in, depending on their tenure ladder, putting in, hey, I really want Christmas Eve off, or I want July 4th off, but I'm third or fourth person in the pecking order, and so I'm not going to be able to get that time off this year. People really want to have control over that, or people are taking care of an older family member, or they want to be more present at home and help out with coaching a soccer team or helping out in a classroom, or in a place like Phoenix, it's really hot in the summer. Some people just want to get out of town for a couple of months in the summer, even if that means working extra in the fall and the winter. And so like what we're doing is, it's unique in the way the features that we bring to people and the talent that we deploy, but it's not unique that people want more freedom, and platforms like NurseIO help to empower people to have more freedom. And then on the facility side of things, there's some structural barriers for nurses right now. 5 to 10% of nurses have retired in the last 5 years. There's not enough nursing programs that are putting new nurses, qualified nurses out into facilities across the country. There's, things that are unfortunately growing, like substance abuse and emotional counseling that's needed, and psychological hurdles that people are wrestling with. So there's all these demographics at work, and there's just not enough people. And so during the pandemic surges with everything, hospitals and facilities did what they had to do to bring in staff. And there was heavy federal stimulus money to do that. But in reality, if you picture a hospital setting for one, the labor spend in a hospital is between 40 and 60% of their overall budget. Wow. And when you bring in a locum or you bring in a longer term traveler on a contract, that's not only really expensive, and 40% of hospitals are not making any money today. Even non-for-profits are not, covering their costs. But also, you can think of the morale in a emergency room or an ICU when you and I are doing the same exact job, but you are under a travel contract and you're making 50% more than I am, even though I know everything I need to know within that hospital unit. So not only is the spend, really difficult for most healthcare facilities to accommodate, but also it's pretty bad for morale too. And surveys and polls and everything else affirm that. And so what we're trying to do is connect those people, those clinicians that want more freedom, with those facilities that are trying to manage their costs, especially with a last minute call out, somebody got sick, are we going to staff accordingly? And we just connect the two in a very easy and straightforward way.
I really like that perspective, Shannon. Kind of bringing it back to the worker flexibility, I totally relate to this. I used to have an old roommate who actually worked as a travel nurse, and she had a really, really amazing life in her 20s. Traveled across multiple cities, would take shifts for 3 months, 4 months, and then have a whole month off to sort of vacation and travel somewhere else that she felt inspired to go to, and then kept doing that. And that was a great way for her to sort of get that flexibility that she wouldn't have gotten with a traditional hospital, to your point, but also have the ability to make money, travel, learn what types of hospitals worked best for her, but also enjoy, her life in her 20s while she wanted to travel and explore. So I really like that and totally relate to that. And moving back to the app-based staffing market, you shared a little bit more about NurseIO's niche in particular compared to traditional staffing companies. But, we've seen in the market that there's a ton of companies now that are working towards building more app-based, shift-based staffing companies. So what do you think in particular is truly transformative about the sort of mobile forward app-based technologies that companies like NurseIO are really investing in?
Yeah, it's several things. We take a lot of pride in the fact that we were the first company to offer transparent pricing. And so some companies will say, hey, if you want a nurse to show up tomorrow at noon, dedicate $100 to us, we'll charge you for $100. And then the company, the app will negotiate with the nurse, okay, you get $30, but we get $70 or, something like that. It's not transparent. We don't ever want to be in the way of a facility putting a compensation out on the marketplace. We don't want to compete with that. We have pre-negotiated flat rates in most of our facilities, and market pricing that's all AI driven. So I can tell you, if you're a nursing director at a hospital, you can press the market pricing button within the app, and you can see exactly the going rate for nurses within your zip code doing a very similar job. That way you pay them what they deserve to be paid. And we have a pre-negotiated rate on the side of that for each shift that's picked up. We were the first ones to offer that. We're the first ones to offer this market pricing that's AI driven that I discussed. We can onboard a nurse within 24 hours, which is all AI driven. Sometimes that can take a traditional staffing company over a month to verify documents, to decipher handwritten records for COVID vaccines or TB. We can do that really quickly. And we were also the first ones in the marketplace that were paying on the same day. Now, if you picture yourself, which most CNAs are women, and most of those women are single moms. And so not only is the rate very important of saying, hey, I'm going to make $20 an hour or $50 an hour if I take that shift, but also if you're getting paid within 2 hours after you finish that shift, that helps your cash flow within your household. Hey, I can go grocery shopping tomorrow. I can, make sure that my kids have what they need for school starting in 2 weeks. You don't have to wait a week or two or a month to get paid like other marketplaces and gig economy platforms do. We're paying on the same day. And overall, and also two-way rating system. Like the facility can rate the clinician, but the clinician can also rate the facility. And so if somebody's, on the nurse side is on their phone the whole time and they're not willing to be a team player and, they seem disinterested and they're literally just there to pick up a paycheck, that's going to come through on the rating system. And also on the nurse's perspective, if nobody's, welcoming to them when they show up for their shift, they have no idea how to enter into the EMR, the records that need to happen. They don't know where to park. There's no good food options nearby. All of those will come up as well of, hey, people were rude to me. I don't want to work there anymore next time they post a shift. So all of these things, and I'm only giving a small subset of what we think are true advantages. But I think sentiment hopefully comes through, that we want to be empowering and help clinicians have freedom, and we want to make sure the facilities get fantastic people to work shifts. And we don't need our name sprung all over the place. We don't need anything fancy. We just want to help people connect and provide great care.
I really like that point, Shane, and I think there's so many win-wins that you just mentioned in that answer. You know, first off, market pricing, that's super unique. I talk to hundreds and thousands of staffing companies each year, and I haven't really heard a lot of people do the market pricing, and that's just in and of itself a huge win, because the facility wants to place the roles, and if the pricing has changed in a localized market, they should know that, and they should be able to act really quickly without a lot of bureaucracy to just enable, the platform to connect more workers to that facility. So I love that. And on the worker side, it's also a win-win, because the worker gets fairly compensated, even on a micro level, whether those rates are changing on a quarterly basis or an annual basis, or even on a week-to-week basis, they're getting fairly compensated for what's market standard. So I really, really love that market pricing point. And another thing that really resonated with me is same-day pay. And you know as well as I know, it's really hard to kind of get same-day pay across to the worker. There's so much that goes into that,
Yeah.
from making sure you have the correct onboarding information on file, making sure that the time is pre-approved, making sure that you have those agreements with your clients that, hey, if we validated that the workers have actually done their work, we're going to send out the payments. We're not going to do this song and dance for 2 weeks for you to approve a time card before we can pay out a particular worker. And then, lastly, it's just the technology that's really involved to actually push payments out for same-day pay for the worker, and making that sort of financial investment as well. So same-day pay is totally an operation. I know, because I help so many companies set that up every year, how much goes into that, but it's a huge perk for the workers, especially in the scenario that you mentioned, where a lot of these RNs are really single moms. They need their funds as soon as they do the work, and that's awesome that you guys provide that perk for them. And kind of, we
Oh,
love
thank you. I
NurseIO.
mean,
We
you
want to
can,
see.
you can
Yeah, go ahead.
go ahead. No, I was just going to say, you can
Oh, I was
imagine
going to say.
how demoralizing that could be. It could be demoralizing if all of a sudden you work a shift, you know you're going to get paid, and then you have to go to a payday loan place, and they're taking 12 or 15 or
Yep.
17% of what you have earned. And that's not even taxes or anything else. That's literally right off the top. So we want to help people to get paid what they've earned, and then to be able to take care of their families.
I couldn't agree more. I couldn't agree more. So now, my next question is really, we love NurseIO, and you guys are working on an amazing niche, and we want to see you sort of in more states. So, right now, NurseIO, I believe you guys are operating in around 7 states. So how do you think about expansion and expanding beyond the initial geographies that you're currently in?
Yeah, most of our business is in Arizona, a little bit in Texas, a little bit in Louisiana. So even a subset of those 7 states that we're, ready to go with. And what we've done is we wanted to make sure we had product market fit. And a lot of people, strategic and marketing people talk about product market fit. We know for a fact across a lot of different facility modalities, from a mom and pop nursing home to a detox center to a rehab hospital to an assisted living center, et cetera, et cetera. We know that we can staff well with people that genuinely care, and facilities are recognizing that in us. So we've recognized those patterns, and what we've done is we have a whole chart that we put together, and our launch plan in several different states. We've identified 10 more markets that have the demographics that we need, right? Of a lot of a need in facilities for short-term nursing care. Also, that nurses are there, and a lot of nurses are on our app, even in states we haven't gone into yet, because they know how easy it is to onboard their credentials. They've heard from friends in other states that we're a good company to work with. And so we combine, there's a need in the facilities, there's nurses that are already on our platform, and the regulatory environment is amenable for us to jump into. Some states make it really, really hard to launch anything staffing wise into that state. That doesn't mean we will never be there. That just means it's not our next 10 markets to go. But we think we're very well positioned literally in the next few weeks, to jump in to several more key markets across the country, that nurses are already there on the NurseIO app, and the facilities just need to be, educated that we're there and we're here to help.
Awesome. And lastly, kind of wanted to ask you a little bit about NurseIO's AI powered platform. I know AI is all the hype across all staffing companies. Everyone wants to do AI. So what are you guys particularly investing in the AI landscape, and what are you seeing good results with around your AI investments?
Yeah, it's kind of a legacy from being a bootstrap company. We've been frugal from the start, meaning we've never taken a dollar from outside investors. We've never taken a dollar from outside lenders. And so we've always tried to figure out a way to do things in a very high quality way and creative way and innovative way, but also in a great value way, meaning we were very early into using AI both on the development of our features and our app and our soon to be launching software, but also that same AI ability taught us that we could bring a lot more features to the marketplace, like some of the ones I've mentioned today, that people can't do really well. So every company now in healthcare, IT, or staffing, everybody's mentioning AI. AI is our native language. It's is how we develop all of our software, our app, our feature sets for facilities. It's all on AI. And so that makes us very, very responsive and quick to the marketplace. If you and I have a conversation on a Monday afternoon, within an hour, I could have a totally different feature to you if it made sense. If you say, hey, instead of, the market pricing for feature that we talked about, could I look at other states that, for nursing homes, so kind of our peer group across the country, what does that look like? And we can, change that within our app or within our easy button within minutes, where teams are still with the big companies. Sure, they can say that they use AI, but they still have huge development teams. They have huge sales teams. They have huge marketing teams. We don't need any of that right now because we know that our history has been frugal, and we want to make sure that the money that we are, spending now is all to continue to make a great product that helps people connect.
Yep, and I really like that point around, the genesis of the company really started as a bootstrap company. So, when you're a bootstrap company, you need to figure out how to automate everything, because you're certainly not going to use outside capital to hire hundreds of workers to do day-to-day operations. So I really love that that's always been in the bloodline of NurseIO. I think a lot of other staffing companies that maybe started off, in a more traditional way with a lot of human capital are now trying to figure out how do they undo those systems, both people systems and technology systems, to now start investing in AI and reap the rewards of it. And I certainly think that the companies that are investing in AI and automation are going to win in the market, because in staffing it's just such a margin game that you have to optimize everything to a T so that you can offer the best value to your workers and also to the clients on the demand side that you're working with. So, yeah,
No
I think
doubt.
this one
No doubt.
concludes the main section of today's podcast. I have 4 questions for you in sort of our rapid fire session that we like to do, Shane. So maybe just answer the next couple questions as quickly as you can. But, for the first question, what's something that you believed about healthcare or staffing that you no longer think is true?
Yeah, I was kind of on the mindset, and I'm a little bit generationally, that nurses just show up and they do their shift and they go home. In reality, your average nurse, they care deeply about what they're doing. They're passionate about what they're doing. And so the burnout rates are very high. And the studies show that when you do integrate, part-time staff and per diem staff and float pool staff, it really helps the morale and the energy overall of a unit, because people do get burnt out and people do need some time to regenerate. And it's not just during COVID, it's any time where you're doing something where you're caring for people all day, every day. It takes a toll. And again, that's a nice benefit that companies like NurseIO jump into, is that we're helping people to stay fresh. We're helping them to duck away for maternity leave. We're helping them take care of a sick child. And that's all because we care, and we're willing to jump in with people at where they are.
Yep. Next question is, what do you think staffing companies and marketplaces should really figure out first, the supply side or the demand side?
I think the supply side. I really do. I mean, if you want a warm body to show up for a shift, a lot of people can do that, right? You post an ad and you send them where they're supposed to end up. But truly a quality person that has the right credentials, the licenses are up to speed, they've been interviewed, they are rated by facilities over a certain amount of time. Nothing can guarantee that every person going out on one of these shifts is perfect, but what we do is try to minimize any sort of risk and know that we are sending a great person with the right credentials and the right licenses to take care of your neighbor and my parents and our children.
Nice. And as someone who came from the medtech space, what is your favorite medtech innovation from the past 5 or 10 years?
Yeah, I've been fortunate enough to be part of amazing teams that are wrestling with, heart valves and digital at-home sleep apnea tests that people can do from their beds without going into a sleep lab. But I think the chapter that I worked in before NurseIO was an internal radiation source for patients suffering from brain tumors. I think that was a brilliant solution invented by Dr. Dave Brockman, and it's helping thousands of patients across the country. So instead of external beam radiation that's coming through healthy brain to get to a brain tumor, this technology is put in at the time of surgery, and so the radiation can start acting right there and then to zap any legacy cancer cells, and it's helping people day to day. And it's a population of patients that don't have much hope, and GT is giving people hope.
So awesome. And lastly, Shane, we call our podcast Great Work. What does great work really mean to you?
Great work means a lot of people that aren't trying to take credit for anything as individuals, but they know the importance of the project or the product or the service that they're working on can genuinely make a difference to other people. That to me is great work. Nobody's raising their hand and saying, hey, I created that last Saturday and everybody needs to get out of my way and I need all the credit. It is, what can we help solve in healthcare today? And all of us with our own skill sets and collaboration and communication and focus, working together to make sure that that solution is not only innovative, but also affordable and ready to help people do what they do best.
Super awesome. Well, Shane, thank you so much for the time today. I certainly learned so much about NurseIO and how you view the future of healthcare staffing. So excited to see you guys continue to scale, and thanks for coming on.
Sounds good. Nice to see you. Take care.
Cool. Awesome.